So after the meningiomas, now comes the parenchymal tumors. The parenchymal tumors at the very first is the lymphoma, the primary CNS lymphoma. That this is the lymphoma that directly arises in the CNS, and mostly the lymphomas they do arise from the lymph nodes, but outside the lymph nodes, like in the CNS, the lymphomas are only 2%. So the CNS lymphomas, primary CNS lymphomas, they make up only 2% of the extranodal lymphomas. Mostly they appear from the lymph nodes, but if we talk about the lymphomas that arise outside the lymph nodes, like the primary CNS lymphoma, they just make up the 2%. And they make up the 1% of the intracranial tumors, only 1%, so they are not that much common. And don't forget, they are actually the 1% of the intracranial tumors, but if you are an immunocompromised individual, then this can be the very common CNS neoplasm. If you are diabetic, if you are suffering from HIV/AIDS post transplantation, by whatever way, if you are immunosuppressed, then this can be the very common neoplasm in your CNS. ठीक है, ओके. और नॉन इम्यूनो कंप्रोमाइज इंडिविजुअल्स के अंदर भी ये हो सकता है, लेकिन रिस्क इज़ इंक्रीज्ड यूजुअली आफ्टर द 60 ईयर्स ऑफ द एज. ठीक है बेटा, इस तरीके से. सो ज़रा प्राइमरी ब्रेन लिम्फोमा को थोड़ा तफसील में डिस्कस करते हैं. इट इज़ मल्टीफोकल ट्यूमर विद इन द ब्रेन, राइट. However, outside the CNS, lymph nodes or bone marrow involvement is rare and late complication, right? I hope you are understanding that the lymphoma primarily of the brain, it is multifocal. और एक लिम्फोमा होता है जो कि आउटसाइड द CNS होता है, उस वो फिर लिम्फ नोड्स को ब्रेन बोन मेरो को इन्वॉल्व करता है, बट बोन मेरो एंड द लिम्फ नोड इन्वॉल्वमेंट इज रेयर एंड लिटिल लेटर कॉम्प्लिकेशन. ठीक है. But what about the secondary CNS lymphoma, secondary involvement of the CNS by the lymphoma? It is the manifestation, its manifestation is going to be the presence of malignant cells within the CSF and around the intradural nerve roots, and occasionally it shows the infiltration of what? Infiltration of the superficial areas of the cerebrum or the spinal cord by the malignant cells. I hope you are understanding what I am trying to say. One is the primary brain lymphoma. That means the lymphoma actually arises from the brain tissue. It is not coming outside of the brain. And it's said to be the secondary brain lymphoma when it is actually arising from somewhere outside the brain, and then as a metastasis it is coming to involve the CNS. And in CNS, what manifestations do you see? The presence of malignant cells in the CSF and the presence of the malignant cells around the intradural nerve roots, and also as a result of metastasis you will see the infiltration of the what areas of the brain? The cerebrum, and the spinal cord can also be involved by the malignant cells. So if I make it easy for you, then I will say this is your brain, and if you develop the lymphoma here, it is said to be the primary CNS lymphoma. And if you develop the lymphoma somewhere outside the CNS and then it metastasizes here to the brain, it is obviously said to be the secondary involvement of the brain, right? But not only the brain, it can involve the spinal cord as well. So I hope it is easy for you now. Primary brain lymphoma, it is very much aggressive. Origin is the B lymphocytes, and it has got very poor prognosis, the worst outcome. The cells are latently infected by Epstein-Barr virus. You come, I mean, it's just a very interesting thing to know. I am suffering from the primary brain lymphoma. If you cut open my brain and you look at this lymphoma, every cell of the lymphoma are latently infected by what virus? Epstein-Barr virus. So this can be a very good point. Okay, when not associated with the immunosuppression, मैंने कहा ना primary brain lymphoma, it can occur in the immunocompromised patients, can occur in the non-immunocompromised patients as well. If you develop the primary brain lymphoma without any association with the immunosuppression, then these lymphomas show phenotype which is typical of the post-germinal center B cell differentiation. आपको पता होगा बेटा, जो लिम्फोमा आउटसाइड द CNS डेवलप होता है उसकी वैरायटीज़ होती हैं बहुत सारी. germinal center differentiation, post germinal center differentiation, right? तो अब मैं यहाँ पे बताता हूँ कि इस बात का मतलब क्या है. If you develop the primary brain lymphoma and you are not immunocompromised, then the primary brain lymphoma resembles what variety of lymphoma which develops outside the CNS? Post germinal center B cell differentiation. Clear? So let's recap this part again, that the lymphoma can develop inside your brain. This is said to be the primary CNS lymphoma, the primary brain lymphoma. It can develop outside the brain, outside the CNS, and can secondarily spread to the brain and spinal cord, said to be the secondary CNS involvement, secondary CNS lymphoma. The primary CNS lymphoma, the primary brain lymphoma, it can develop in the immunocompromised patients most commonly, and can develop in the non-immunocompromised patients as well. The CNS lymphoma which develops in the immunocompromised patients resembles what variety of lymphoma which develops outside the CNS? Post-germinal center B cell differentiation. I don't think it is difficult anymore. So yeah, let's go a little ahead and we see now the morphology part. The morphology part of the lymphoma. Okay. The sites which are involved are the deeper part of the gray matter and the white matter. Okay. And not only the cortical tissue, but it can spread to the periventricular areas, which is very much common. And the tumor is very well defined compared to the glial tumors, which are very much infiltrative. Glial tumors, I have discussed a lot about them, that these tumors are very much infiltrative and their boundaries are not very much demarcated. Compared to glial tumors, lymphomas are well defined, right? And the most common histologic type of the CNS lymphoma is considered to be the diffuse large B cell lymphoma, B cell origin जो होता है, B cell origin tumors. And this is the reason they express the B cell markers like the CD20, because yeah, they are of B cell origin obviously, so they have to show the B cell markers. The tumor cells infiltrate the parenchyma of the brain inside and accumulate around the blood vessels, right? And a very interesting thing is that the infiltrating tumor cells are separated from one another by a very important silver staining material. And this pattern of the cells is called the hooping. Let me tell you again. Let's recap this morphology part. The lymphoma that primarily develops inside your brain. What is the site of origin? It actually involves the deep part of the gray matter, white matter, and the most common part where it spreads is the periventricular region, right? And these are the very well defined tumors compared to the glial tumors. What is the most common histologic type of primary brain lymphoma? Diffuse large B cell lymphoma. Tumor cells infiltrate deep into the brain parenchyma. So while they are infiltrating down, if you look at the cells, the two cells are separated from one another, and in between the two cells there is a silver staining material that is actually रेटिकुलर स्टैनिंग से वो सिल्वर स्टैनिंग मटेरियल विजुलाइज भी हो जाता है. एंड दिस पैटर्न ऑफ सेपरेशन ऑफ सेल्स इन द प्रेजेंस ऑफ दिस मटेरियल बिटवीन द सेल्स इज कॉल्ड hooping, right? Okay, right beta. One variety of the lymphoma is the intravascular lymphoma, right? And it is usually it is actually itself very much unusual, but if it develops, it is large cell lymphoma usually within the small vessels of the brain and the other regions of the body. So previously I told you the primary CNS lymphoma, that is what we discussed about in the morphology. The lymphoma can be secondary CNS lymphoma. इसका origin outside CNS होता है, जाहिर सी बात है, और इसका origin CNS से होता है. The intravascular lymphoma, that means the lymphoma that is arising, that is growing within the small blood vessels. And what variety of lymphoma this is? Large cell lymphoma, okay? And once the blood vessels are affected by this lymphoma, there is the occlusion of the vessels by the malignant cells, right? If you look at this blood vessel, Then you can see this blood vessel, how beautiful it is with a very good caliber. And this is the lymphoma growing on the blood vessel, and you can see the malignant cells are actually occluding the blood vessel. So blood will be unable to pass to this tissue. So this tissue will undergo infraction, and there will be microscopic infarcts in the brain tissue, right? How will you you think what will be the presentation of the patient with this intravascular lymphoma? Non-localizing neurologic symptoms, right? Especially the seizures. Patient, you must be confused with vasculitis or dementia, right? But this is not the vasculitis, it is actually the tumor which is growing in the vessel wall, and this is the intravascular lymphoma, right? Okay, this was the very important parenchymal tumor. Then another parenchymal tumor is the pineal parenchymal tumor. It arises from the cells of the pineal gland, that are the pineocytes. It can be low grade tumor, that is very well differentiated. It can be high grade tumor, poorly differentiated. Low grade well differentiated pineal parenchymal tumor is said to be the pineocytomas. They affect the adults. However, the high grade poorly differentiated pineal parenchymal tumors, they are said to be the pineoblastomas. They do not affect the children, but they do not affect the adults like the pineocytomas, but they affect the children's, and they separate throughout the CSF, right? So the pineal parenchymal tumor can be of low grade variety, can be of the high grade variety. Low grade variety is said to be the pineocytomas affecting the adults, and the high grade variety known as the pineoblastomas, and they affect the children's. The underlying mutations that can be responsible for the development of these tumors are the germline mutations in the retinoblastoma, right? A very important gene. Okay. Lastly, beta, after the parenchymal tumors comes the part of the metastatic tumors. That means the tumors developing outside the brain, they can metastasize to involve the brain. These are mostly carcinomas जो कि बाहर से spread होके brain के पास आते हैं. The five most common primary sites, beta. One is the lungs. Number two is the CA breast. Melanoma of the skin, kidney के malignancies, GIT के malignancies like the CA stomach. So these are the five most common primary sites जहाँ पे कार्सिनोमा डेवलप होता है, फिर वहाँ से स्प्रेड होता है, फिर मेटास्टासाइज होके आपके ब्रेन को इन्वॉल्व करता है. ठीक है बेटा. सम वेरी रेयर ट्यूमर्स लाइक द कोरियोकार्सिनोमास, उनका अगर ये डेवलप हो जाएं, दे हैव वेरी हाई लाइकलीहुड ऑफ मेटास्टेसिस टू ब्रेन. या बट देर आर सम वेरी कॉमन ट्यूमर्स लाइक द CA prostate, but they never metastasize to the brain. You understanding what I'm trying to say? कुछ बहुत अनकॉमन से ट्यूमर्स हैं लाइक कोरियोकार्सिनोमा, अगर वो एक बार डेवलप हो जाए तो फिर फटाफट से ब्रेन को इन्वॉल्व कर लेते हैं. लेकिन कुछ कॉमन मेलिग्नेंसीज हैं जैसे CA prostate, लेकिन वो हमने तो नहीं देखा कि कभी उसने ब्रेन को इन्वॉल्व किया हो. So this is the fact you have to remember. Apart from brain, metastasis to epidural or subdural space, if involving the spinal cord, it can cause the spinal cord compression and the obviously compression of the spinal roots as well, nerve roots. So it can be very much painful condition. So this was what you have to keep in your mind about the metastatic tumors. A little about the morphology of the metastatic tumors, that once the tumor has metastasized from distant site and now it is in the brain. So what is the morphology? The tumors tend to be sharply demarcated at the junction of the gray and white matter. Let's suppose I develop the CA lungs, and from lungs the carcinoma spreads to the brain, and you look into the brain and you will see the tumor is present at the junction of the gray matter and white matter, right? And the tumor is sharply demarcated, and the tumor is surrounded by the zone of the edema. And if you see here, then you can see this is okay, this is the gray matter and below is the white matter, right? So this is present and the tumor is present at the junction of, and you can see this is very much sharply demarcated tumor. It is present at the junction of the gray matter and the white matter, and this tumor is actually surrounded by the zone of the edema, okay? And you can see the boundary between the tumor and the brain parenchyma is very well demarcated. If you see, if this is the gray matter, this is the white matter, this is the tumor. You can really see this is the boundary of the tumor, and the rest of this is the normal brain parenchyma. So there is actually the clear demarcation between the tumor and the surrounding normal brain parenchyma, right? But this rule is not followed by the melanoma. If you develop the melanoma on your skin, and if it spreads to the brain, in the brain you will see the melanoma very much infiltrating, and there is no clear differentiation, no clear demarcation between the normal brain tissue and the metastasized melanoma, right? Okay. What about the meningeal carcinomatosis? Meningeal carcinomatosis associated with the formation of the tumor nodules on the surface of the brain, spinal cord, and the intradural nerve roots. They are associated with the CA breast and CA lungs. If you come to see in your brain, there is the development of carcinoma of the meninges and the formation of tumor nodules on the brain, spinal cord, intradural nerve roots. This type of presentation is seen most commonly with CA breast and CA lungs. If let's suppose I develop the CA breast, the CA breast will separate out of the breast and can go higher into the CNS and can produce meningeal carcinomatosis and the tumor nodules. So if you develop the meningeal carcinomatosis and tumor nodules, so we can say, okay, this presentation, meningeal carcinomatosis and the tumor nodule formation, this is most commonly associated with, what? CA breast and CA lungs. This is what you have to keep in your mind, but that's it. This is what important for you. Lastly is the neurofibromatosis. Not really important currently here in this part, but let's have few words about the neurofibromatosis. Neurofibromatosis type 1, type 2, they are two autosomal dominant disorders, neurofibromatosis type 1 and type 2, right? Actually this is a familial syndrome in which there are the multiple tumors of the central nervous system and the peripheral nervous system. Two types of neurofibromatosis, NF1 and the neurofibromatosis 2. Out of these two, the neurofibromatosis 1 is more common, and this neurofibromatosis type 1, which is common, is characterized by the presence of what tumors? Number 1, neurofibromas of the peripheral nerves. Number 2, gliomas of the optic nerve. And number 3, the formation of pigmented nodules of the iris that are known as the leash nodules. And number 4, there is the cutaneous hyperpigmented macules, जिसको कैफे ऑलेट spots कहते हैं. So these 4 are the common characteristics of the neurofibromatosis type 1. If somebody asks you what are the malignancies we see in the body if you are suffering from the neurofibromatosis type 2, then these 4 are the ones which you have to keep in the mind. Neurofibromatosis type 2, less common than neurofibromatosis type 1. What malignancies do we see in NF2? One is the bilateral schwannomas of the vestibulocochlear nerve, multiple meningioma formation, and the glioma especially involving the ependymal cells of the spinal cord. So this is what a little about neurofibromatosis, right beta? And this is all about the CNS tumors. We'll now continue with another chapter of the neuropathology, a topic of the neuropathology. Thank you so much beta. Class dismissed.